Yes, this is actually a trial that we started quite a long time ago, and it was designed to evaluate the relative efficacy of novel microtubule inhibitors given in a weekly schedule compared to the standard, which was paclitaxel. At the time, bevacizumab was a standard of care as first-line therapy for metastatic HER2-negative breast cancer based on the results of ECOG 2100. So our control arm was weekly paclitaxel, 90 milligrams per meter squared, 3 weeks on, 1 week off, with bevacizumab. And then if patients had responding or stable disease after 6 cycles, which was the 4-week is a cycle, they could stop the chemotherapy and continue on with bevacizumab alone. Our two experimental arms were weekly ixabepilone, which had been approved based on efficacy in taxane-resistant disease as well as superiority in combination with capecitabine, but it was given every 3 weeks and quite toxic. So we were evaluating weekly therapy, same schedule, 16 milligrams per meter squared, and the second experimental arm was nab-paclitaxel, and a randomized phase 2 trial conducted in Russia, published by Bill Gradishar, had shown improved efficacy with 150 milligrams per meter squared compared to both paclitaxel and compared to every 3-week paclitaxel and to docetaxel. So the idea was that we would study that dose, which we did with each experimental arm was compared to the control rather than to each other.